Thank you. We'll move on to House File 3444. This is also your bill, so we're all set. You may turn your page and proceed. Representative Mahmoud moves that House File 3444 be laid over for possible inclusion in an omnibus bill. And we would ask you to just describe your bill. Thank you, Representative Mahmoud.
Thank you, Chair and members of the committee, for allowing me to present House File 3444. Today we're talking about something very simple. When Minnesotan is ready to begin treatment for opioid use disorder, the system should not make them wait. This bill removes prior authorization and step therapy requirements for FDA-approved medications for opioid use disorder, also known as OMOUD. These medications, buprenorphine, methadone, and extended-release naltrexone are gold standard for care. They reduce cravings, lower overdose risk, and help people stabilize their lives. But too often, when someone makes the decision to seek treatment, sometimes months or years after struggling, they encounter an administrative delay, a form, a review, a wait period, and in the context of opioid use disorder, delays matter. The window when someone is ready for treatment can be short, relapse is high, and in some cases, delay can even mean overdose. Prior authorization is not clinical care, it is paperwork. It does not improve medical decision-making. It creates friction for patients and providers alike, and it disproportionately affects those on public programs. Minnesota already recognizes that certain medications are too critical to delay, including protections for HIV and AIDS drug classes. This bill applies to the same logic here. If coverage exists, treatment should not be blocked by administrative hurdles. 22 other states have taken steps to limit or eliminate prior authorizations for MOUD because the evidence trend is clear. Reducing barriers, improve access to support continuity of care. Members, this is not a partisan issue. It is a public health issue. It is about removing red tape so that people can access evidence treatment when they are ready. So I'll ask for your support and open it up for testifiers.
Thank you, Representative Mahmoud. First up to testify, Dr. Kelly. We'll see him again. And then we have a virtual testifier after Dr. Kelly.
Welcome back.
Chair,
Please
members.
proceed. We know who you are. Thank you
Good to
very
see
much.
you all again. I'm going to give you warning. I'm going to talk about some sad things. I'm testifying in support of House File 3444. I mentioned that my name is Ryan Kelly. I'm internal medicine pediatrics. I'm also an addiction medicine doctor. My testimony also is representing, I'm also representing the Minnesota Medical Association. So I've been prescribing medications for opioid use disorder since 2015. Back then, life-saving medications like Suboxone, one of the most common forms of buprenorphine, required a prior authorization. In clinics like mine, we'd have to hire specific people that their only job was to do prior authorizations for Suboxone as fast as possible. But even then, the fastest we could get this medication back then was anywhere between 1 and 3 days. So what that meant is I'd have someone come to clinic in withdrawal, wanting to stop using heroin. I'd send the medicine to the pharmacy, but I have to tell them, hey, hopefully it'll be there within 3 days. Time and time again, we'd never see this person again. We'd find out days, weeks, sometimes months later that they had overdosed and died. I'm going to fast forward and tell you a little bit about a patient dear to my heart. The first time I met Ray was actually many years ago. Actually, he'd been struggling with homelessness, severe opioid use disorder. I met him in the hospital. He was dealing with the consequences of injecting drugs and had a heart infection. But with the life-saving access to medication like Suboxone, he was actually not only to, become sober, meet his goals, he actually, got housing. He became a pillar in his community. His entire housing complex recognized Ray and his bright smile, which would warm the room, and his cat, Jem. He started working. He was supporting not only his mom, but his sister. Unfortunately, last spring, as what happens with substance use disorders, Ray relapsed. Due to the inherent properties of fentanyl, time and time again, we kept trying to get him on Suboxone. He was motivated, just wouldn't work, and he kept getting sick. Well, finally, I last saw Ray end of September on a Friday. We decided we were going to do prior authorization for Brixadi. He was so excited, and I told him, we're going to have it Tuesday, man. Monday, his mom came to clinic. Sunday afternoon, Ray went to the pet store, got cat food for Jem, took a hit in the car, and didn't wake up. Anything that we can do to get access to these medications that currently exist or future medications for opioid use disorder is going to save lives. I'm available to answer any questions. Thank you.
Thank you for your testimony, Dr. Kelly. Next online would be Jason Urbanchik. Can we do a sound test?
Yes, can you hear me well?
Sounds great. Please introduce yourself for the record and proceed with your testimony.
Thank you. My name is Jason Urbanchuk. Good afternoon. Thank you, Chair Bierman and Chair Bacher, members of the committee, for hearing my testimony today. My name is Jason Urbanchuk. I'm here as an executive committee member with Impact Minnesota for the Minnesota Coalition for the Homeless, and alongside many other hats I wear in our community. I currently reside in Moorhead, Minnesota, and I'm here today because I've survived something that a lot of people haven't. I survived the wait that the doctor was just talking about. Excuse me. Let me tell you what the wait really means in my world. Wait looks like defeat, means I'm never going to get help. Wait looks like a death sentence disguised as paperwork. Picture this, you wake up one morning in a rundown motel, the same morning you normally wake up and the first thing you do is use heroin. But not today, something inside you shifts. You decide to try, you decide to fight, you drag yourself to a clinic at 5 a.m. to wait in line hoping you get in at 9 a.m. and there's still a spot for you. Shaking from withdrawal, terrified and ashamed. You sit in a room with strangers and confess the darkest parts of your life. You've done the hardest thing a person in active addiction can do. You've asked for help. And the doctor says, yes, I can help you. They write a prescription for a medication that can save your life. For the first time in a long time, you feel a flicker of hope. And then you hear the words that kill the hope. Your insurance company needs more proof. It'll be a few days. Hang in there. Hang in there. When your bones feel like they're breaking from the inside, when your skin feels like it's going to crawl off your body, your brain screaming for relief louder than any rational thought. Every second feels like punishment for trying to live. Most people can't hang in there. They go back to using. It's not because they want to, but because withdrawal is a kind of suffering most people will never understand, nor would you want to. Trust me. This is not a story. This is my life. I was forced to wait twice. And one of those times I didn't make it. I overdosed. I was that close to help and still dying on the floor. If someone hadn't found me, I wouldn't be here speaking with you today. And do you understand what this does to a person? To finally reach out for help and be told to wait, to be ready to live and be pushed back toward death. When somebody is ready for treatment, the window is very tiny. The window for the will to get treatment is even smaller. We can't pretend prior authorization is harmless. It kills people, not in theory, not on paper, in real life and in real time. These outdated processes destroy trust in doctors, in systems, in authority. People don't turn away from treatment because they want to be difficult. They turn away because they've been hurt, dismissed, or abandoned by the very institutions that were supposed to protect them. I've been in recovery for 7 years, 3 months, and 22 days now. That is because the third time I didn't have to wait. Suboxone has saved my life. It's given me stability, dignity, hell, it's given me the ability to take control of my life and be the man that I am supposed to be. And at the same time, my heart breaks every time I hear about someone dying in the same gap that almost killed me. Doctors know what their patients need, insurance companies do not. And it is dangerous and frankly irresponsible to let insurance companies override medical judgment in the middle of an overdose crisis. Minnesota has a chance to do something simple and profoundly life-saving. End prior authorization for methadone and buprenorphine, let doctors treat and let patients live. I'm standing here today because someone gave me access to treatment without delay, and I want every Minnesotan to have the same chance, not just the lucky ones. Thank you.
Thank you, Mr. Banchik. Any members of the public wishing to testify on this? Seeing none, we'll go to discussion on the bill, and I have Representative Keeler.
Thank you, Chair. I hope Jason is still on. Jason is a constituent of mine. And I met Jason back in 2020 when I started this campaign. And I think we all have moments in our life where somebody just says something to you that's so profound. And you know what Jason said about he survived the wait, you just have no idea how many people don't. and how that impacts generations to come. I lost my niece because she wanted so bad to get better, but surviving the wait is the hardest part. And I want to thank you for carrying this bill, but more, I really want to thank Jason. Jason made a comment to me early on in my sobriety, in my walk with sobriety, that said getting sober was the best thing he ever did for his mental health. And I think that in a time that we're all doing what's best for our mental health, and we know that this is an act of absolute resilience, that we need to listen to the people who are border to border asking for us to do this. This is actually something that will save lives, and it will save lives every day. This isn't just one and a minimal amount. We are losing our kids to things like this. And so the courage to continue to speak up, and Jason does such a great job. This is also why I just want to highlight the importance of having remote testimony so that we can continue to hear these powerful stories from across the state. And so thank you, Chair. Thank you for carrying this, and thank you, Jason, for your amazing testimony.
Thank you. Representative Bonner.
Thank you, Mr. Chair. More comments than questions, but what we're trying to do here today isn't new. We've been trying to do this for a while, actually. In fact, if I'm not mistaken, the language we're striking here and replacing was, I believe, Representative Kelly Morrison's bill that we passed a couple of years ago. And again, a couple of years, then a little longer passed. And the bill that I passed on prior authorization that went into effect January 1st of this year includes things like chronic conditions. So you only have to do prior authorization one time. And then you don't have to prove that you still need your insulin year after year, even though you can't live without it. But the one thing that was on the top of that bill that we tried to pass was actually this. And we didn't pass it. And does anybody want to know why it failed? Anybody? It failed because it costs too much. But here's two people who came today with the courage to talk about what they've been through. It costs too much. But I have to ask people in this room, what is a life worth? What does that cost? And these are folks who are sitting in a situation in which they cannot wait, in which prior authorization is not useful. It is actually a barrier to people to getting life-saving care. And for that reason, it frustrates me infinitely that I didn't get it passed the first time and that we are still here having this argument. We know that getting this care to individuals saves lives. And yet, we continue to argue about the cost, and we continue to argue about what it's worth to save someone's life. And I just think that maybe, just maybe this time, we'll listen. Thank you.
Members, we are at time, so first off, apologies to the next bill. We will move that forward. Thank you. You have closing comments?
I'll just say thank you guys for your time. Like I said before, people can't wait. This bill will save lives.
All right. Representative Mahmoud renews the motion that House File 3444 be laid over for possible inclusion in an omnibus bill. We will have some work to do on this, the last one, and we'll move them forward together in an omnibus.